Hello, everyone. Thank you for logging in. My name is Rend Al-Khalili. I am an attending radiologist at MedStar Georgetown University Hospital, specialized in breast imaging. I will be talking to you today about the differences and similarities between academics and private practice, and kind of share some tips with you to help you decide between the practice settings. The reason why I always give this talk is because my first job after fellowship was in private practice, where I stayed in 2 years before I transitioned completely into a full academic position. But before I start, I just want to tell you that it is really hard to decide what kind of practice you want to end up in when you're still in training, because the setting is very different. You're only familiar with the academic practice when you're in training. And life is very different and can be a little easier when you're not in charge. So sometimes you won't know what type of practice that you're going to want to be in until you are actually in your first job. So the outline of this lecture, we're going to talk about the pros and cons of academia versus private practice. How do you decide between the two? We'll go over a typical day in the two practices, from a personal standpoint, and then we'll discuss some takeaway points. So academic radiologists are considered a minority, but we talk about it a lot because the majority of training programs are academic. Most trainees are familiar with it and know that the primary drivers are research and education. So the practice model is changing. Traditionally, academic practices are based in large academic medical centers, but now more and more academic networks are expanding into the community. So the practice model is changing, and you can see now there are some academic radiologists who are primarily community radiologists, but they either hold a hybrid position or they have an academic appointment. But if you look at their practice, they are, in private practice under an academic name. What I liked about academia, or what I still like about it, is that I can contribute to research and innovation. And by that is that there's just much more than clinical work. There are opportunities to do research and participate in developing new technologies. It's always easier to subspecialize and do 100% of what you are trained to do. And you can have the chance to go deeper in your field and become not only an expert, but potentially a leader. There are teaching and mentorship opportunities, and in fact, many of us chose academic at some point in our training, a role model or a mentor that we really liked. And we can continue to develop these relationships and actually make an impact in the younger generation that you'll be remembered for. There is collaborative work, and when we talk about that, is that we work together as a team in academia. We show interesting cases, we discuss some complex ones, and we cross-cover each other all the time. And the reason why we can do that is because our job is pretty flexible. Our schedule is flexible. There is less pressure to produce, and we have the time to do all of that academic work. And it's safer to say that, you know, academia has a more stable job than private practice, and you're going to hear from other great speakers on that. The downside of academics is that obviously there's a lower compensation ceiling. There's some politics that you deal with in any hierarchical system. There are people that you want to make sure that they are pleased with your work, with your progress, with your research. And it's sometimes hard to balance between the clinical demand and between providing the teaching and the research that you are working on. So sometimes it's not easy to take academic days, and sometimes you just don't have enough time. And some of those who have kids, they might end up doing a lot of the work at home at night after they put the kids to bed, or on the weekends. Now, when I was in private practice, there are things that I liked about private practice as well. The thing about private practice is that the focus is changed from research and education into improving or honing your skills to provide better patient care and an efficient practice. Obviously, there are more job opportunities out there. So it's safe to say that if you are a fellow looking for a private practice job, you are more likely going to find one. And the majority of the graduates in the US, they end up in private practice. There are different practice models. You can be in an outpatient facility, you can be in a community hospital. And also the practice continues to change. Now we see less of the solo groups, the small groups, and more of the large consolidated practices under large corporates. So what I personally liked about private practice is the variety. I was able to do a lot of things different from breast imaging, for example. I did something different every day. I had a more flexible opportunities, let's say not necessarily the schedule, but I was able to switch from full-time to part-time after I had my babies. If I needed some coverage, I was able to find coverage, that there was easier schedule switches. I just had to work extra hours, for example. And for most people, there are more jobs, as we discussed. So that's what we mean by flexibility also. The autonomy and decision making I liked. There was less politics in private practice, but they exist. They're just different kind of politics, and we can discuss that later in the panel as well. Efficiency is key in private practice because most of the practices are good about hiring highly trained and experienced technologists. They know exactly what you want. So for example, if you're doing a procedure, they know what you need on the tray. They know exactly what approach you always take. So they are ready for you. They provide everything for you. So when you go in and out, you're done. And that makes a huge difference and enables you to handle the high volume of the practice. And of course, it's financially attractive if that is something that you're looking for. The downside of private practice is that it lacks job security. And what we mean by that is some of the practices have contracts with hospitals and they have to renew these contracts every few years. And if they decided not to renew, you're going to have to look for a new job, or maybe you leave as a group. So it doesn't always happen, but it's a possibility. There's variable productivity. As we discussed, there's less pressure of productivity in academics. So they want to make sure that you are producing a lot of numbers, and that's why you have a higher volume. But we discussed the efficiency in private practice and how you can handle this high volume by working with experienced people. You have longer work hours, but we'll discuss that when we talk about the typical day, is that even if you have longer hours, when you are off and you really enjoy your days. And also it lacks day-to-day teaching and research opportunities if you are a person who likes to do this kind of thing. So how do you decide? It's not easy to decide, but what kind of helps you is that you have to define what you want to do. So let's look at a person, let's say a typical person in academics. I look at them as ambitious people. They like to educate. They prefer to work with experts and learn from them, especially in the first years after graduation. And they like to read at their own pace. They don't want to be pressured because they want to, share the cases with the trainees or with the colleagues. They have interest in leadership and mentorship. And what I mean about self-education is that, for example, when I was in private practice, I wasn't so great about self-educating myself. Is that I did not have the time because of my kids and my obligations. I didn't have the time to always keep myself up to date and read. But in academia, I am forced to do that because I work on lectures and I have to make sure that I am up to date with the guidelines. I know exactly what research is coming out. And then we have some journal clubs. We go to grand rounds. So if you're not so great about self-education, then academics can be a place for you. And you want to make sure that you have a supportive home situation because, like I said, you will do some of your work at home. You want to make sure your kids are taken care of and you have a supportive atmosphere. Now, what are the goals for someone in academics? Some people look for prestige, and some people like to work in a medical school and like to see their names in journals and newsletters, and they like to get teaching awards and be on the promotion track from assistant to associate to full professor. They like to master the one thing that they learned, and they become inspiring leaders. Now, private practice, I look at them as, to be honest, superheroes. They are multitaskers, they are fast and efficient. They don't like to be interrupted. They don't mind being alone during the day because they want to finish the work, they want to get out on time and be with their family and do the things that they enjoy. They can handle the high volume, and they're good about practice building and marketing because they share some profit, and they care about the practice. They like the autonomy. And like I said, they're good with self-education. Now, what are the goals in private practice? People like to have, like to provide great patient care. They want to keep the general skills and don't forget how to read a CT. For example, I've been doing breast imaging for so long, I haven't even read a CT or a broad EMR in so long. They want to feel that they are financially comfortable. Some people are the main breadwinners in the family. They want to make sure that they can, have the luxury to travel and have their kids in private schools and invest and do the things that they enjoy. Their goal is to become a partner, whether they're a 2-year, 3-year, or 5-year track, but eventually they want to share the decision making. They want to share the profit. They want to have a good personal lifestyle. And if they want to get involved in societies, that's always encouraged for people in private practice to join the ACR chapters or the local societies where they live. Now, how do you go about deciding? So what I encourage residents is that during residency, get exposed to what you don't usually see on a daily basis. So we all know when we're in residency, we know what our attending's life looks like, but we don't know what people in private practice, how they function. So what I would say, if you know people, if you can get in touch with alumni from your program, and if they are in private practice, just see what their life is like and learn about it, or ask to shadow for a day or two. um, get to know yourself, because you'll know if you are a very fast resident and you dictate in time. You're so good when you are on call. You don't spend an extra hour or two trying to finish up. You're one of those who finish or kill a list in 2 hours. You get really excited when you see medical students wanting to shadow you. Of course, this is before the COVID time, but you also have interest in research, and you do a lot of projects with your attending. So you'll know what type of person you are and what's going to make you happy. Now, during fellowship, this is it. You'll know what type of work you'll do. So can I do this every single day for the rest of my life? Like I said, get unbiased opinions. So not only talk to your attendings, but talk to other people or graduates of the program. And start the process early, because the more options you have, the more time you're going to have to pick and choose and prioritize. So some people like to make sure that they go back home or a certain location where they have a lot of family and friends and a lot of support. It doesn't matter what type of job they have. But some people like that they want to focus on the type of the job, whether it's full-time or part-time, or the call hours and the work hours. So you want to make sure you define your goals, and that would help you decide of what you want to do. So this slide, I find it helpful for residents and fellows, because it just basically summarizes a typical day in academics versus private practice. And it's based on my personal experience, because I was exposed to both two practice settings. So in academics, the type of work you do, like we said, it is subspecialized. Usually you're on one rotation. For example, if I'm on diagnostic mammograms, I am on diagnostic mammograms. I'm not going to be doing other studies. If I have some downtime, I'm going to sit down, either teach or show an interesting case to the residents, or if I need to catch up and work on a project, I will do that. I can go to conferences. I can give lectures. I can go to grand rounds, go to QA meetings and faculty meetings. My interaction with colleagues and residents and fellows and technologists, and of course patients, and it's such a dynamic environment. The setup is, it's usually in academics, you have a shared reading room, whether it's a big reading room or small one, but you're always sitting with someone there. You discuss and chat and show cases, and sometimes you discuss, children, and discuss fashion and other things. We usually we have an academic day, and it depends again on the job. But I do have an academic day once a week, which is really great. And I try to catch up on lectures and research. And I also have a day off because I'm a part-timer, but believe it or not, I don't do anything fun on my day off. I also try to catch up and work on my research. But I enjoy it, and this is what I want to do, and it gives me the fulfillment and the job satisfaction. Now for calls are different, but my calls, I do weekend calls, I do general calls, so that's really nice because I like to keep my skills. And some people, they just do subspecialized calls. And for breast imagers, for example, mostly they do breast calls, meaning they do diagnostic weekend. In private practice, when I was there, on a typical, day, I would read different exams. Yes, I am scheduled on diagnostic mammograms, for example, but I'm also reading plain films. I'm reading DEXAs. I do a couple biopsies, and in the afternoon, I switch to ultrasound. So I like that a lot because it just kept me, going from different rooms and seeing more people and doing different things. But if I had some downtime, I had to read more studies because there is really no downtime in private practice. Again, this is from my personal experience. Conferences, I was an outpatient. I didn't have any conferences. I didn't have any tumor boards, but they exist if you work in a community hospital. The interaction was mostly with technologists and patients. My colleagues were available via telephone if I needed to talk to them or if I had a question. But I was just alone there, and I was in my own reading room. I didn't share the reading room with anyone because we didn't want any interruptions, so I can handle the volume. I had no academic time, but I did have days off. But I tell you, those days off were precious because I enjoyed them with my kids. I did a lot of fun things that were absolutely, unrelated to work. And calls, I had no calls in my practice, but the calls depends. And most private practice would require you to do general call, and some of them are, either weekends or night shifts. It depends. So if you got your first job and you're not satisfied, or maybe you just realize that this is not what you want to do because you didn't know what kind of person you were, or you were full-time and you felt that this is time to move on to a part-time job or to something different, you can always explore other options. You're not tied to your first job. And yes, you hear that it's different or difficult to switch from private practice to academia or vice versa, but I would tell you that it is not hard to do that. There are people who worked in private practice for years, and all of a sudden they're in academics, they're publishing, they're teaching, they're going around the country to give talks. And also or if you're tired of doing that in academics and you want to switch to private practice, you can do that as well. And I don't think that this is a problem also from a personal experience. So take home points is that, yes, there are different practice settings, and they can be really different. But if there's something that you really enjoy and you want to do, you can absolutely do it no matter what practice setting you are in. You can get an academic appointment if you're in private practice. You can offer to do board reviews. You can offer to volunteer in medical schools and interview students. You can get very involved in local societies, and always wherever you are, you can come up with that work-life balance. And I know it's hard, but you can work on it. And then, of course, you want to make sure that you always have a great reputation of being a great radiologist and you're providing great patient care. The most important thing is that you have the job satisfaction. I always say that you want to wake up in the morning feeling happy to go to work. You're excited to go to work and to be with your colleagues and to see your patients. And again, remember, your first job is not your forever job, so never stop looking for what makes you happy. And with that, I thank you guys so much, and I am available for any questions. Thank you.